like my home, honestly. I've been coming here at least 11 times and been to different places. And I always speak hard of the military. They are quiet, they are polite, they learn to learn, they are not arrogant. And I will thank also Abu Hassan al-Ash'ari during the lecture. So I will go through it now. So, how do you start? Okay, I mean, because this meeting is so great because you listen to people from different areas. I'm a civilian. I never been a military surgeon, but I was squeezed for 1 year to be within a war area. Now, for example, in Syria, civilians people are practicing for 5 years, and we learned a lot. We learned a lot from military people. If you look to the progress in surgery, for example, we learned the damage control surgery, portable ultrasound. By the way, suicide was actually used too much in the military, so civilians followed them in that. The principle of 1-to-1-to-1 blood transfusion was actually taken from the military, from the Iraq war. The tourniquet that has been presented yesterday in Paris injury, you see some slides, hemostatic agents, new material that can stop the bleeding in the wounds, large wounds. All of these are actually from the military. But what can we learn from the military? Errors. Errors is a killer, I can tell you. We all make errors. I made errors. But unless you close the circle of picking up the errors, you will never improve. Okay. If you go to errors can be in 1-3 areas. It's an area, the frontal part of the brain is the cognitive part. So you can have a cognitive error. That, for example, this goes into the critical decision-making process. How do we make decisions? That's a cognitive area. The psychomotor domain, which is, let's say, an improper technique during surgery, it's related to coordination between the brain and the hand, and you can make an error. One of the famous stories in Hong Kong, someone was doing a colonoscopy, and he listened to a phone which rang, and he perforated the colon. The third one is emotions. Although emotions, this is well-known history in the literature, is smiling, my colleague from Hong Kong is smiling. The third one is actually affective domain. If you get angry, we know that emotion is the most important factor in getting decisions, but sometimes you overreact and you can really have bad relationship with your colleagues. Now, if you look to the title here, we have Professor Dato Siri, Dr. Abu Hassan al-Ash'ari, etc., etc. Now, I have here my colleague from Philippines, with excellent tone. He was to be my chairman, by the way. And there is a connection here. You know, look to Professor Abu Hassan al-Ash'ari in Sarawak, 2014. He acts like a military man. He's a good organizer. He's a strong man. That's the message a way that you will see tomorrow like that. Now I'll go to another, Dato Siri Taon Bagat Sadagat Lapu-Lapu. And that means actually, the Dato Siri is a Malayan name, means the Honorable Lawan Sir, chief man. And Taon Sadagat means the sailor, a man who is a sailor, and Bagat is a warrior. So he's a warrior in the sea. This is a very famous hero, national hero in Philippines. And he lived in Mactan. Yesterday we heard about the tsunami in Mactan, and he lived about 1,500. Just imagine that. Now we are in Malacca. And in Malacca in 1511, Magellan came with the people from, he was a Portuguese, by the way, very similar to Ronaldo. He's a Portuguese playing in Spain. So he was a Portuguese, he was dismissed by the Portuguese king, and he went to the Spanish king to play with him. Initially, he came in 1511, he was with the Portuguese team. And he was one of the people who conquered Malacca in 1511. Now the other, so that's the first main kind of the story. The other one is called Enrique of Malacca or Henrik of Malacca in their language. He's a very clever Malay who's quiet, who doesn't talk too much, but you will see what he will do. Now, 10 years later, these two people in 1521 met together in Maktab. That's the story that we will have. And there is another guy called Raja Hamabo. And he changed his name, he was baptized, his name was changed to Don Carlos in 1521. So what happened? These are four characters. What do they do with surgery? I mean, it's astonishing, isn't it? Now Magellan, as I told you, he did not have money. The king of Portugal was not so happy with him, so he went to the king of Spain and he convinced him, I want to go to the world from the east. He actually came to Malacca from the west, through the south of Africa, and through the European, the actually Oman and Ras Al Khaimah at that time, which is actually called Ras Al Raja Saleh in the Arabic world. So he came from the west. Now he wanted to prove that he come to the Indonesia. He was going to the Spice Island because 1 kilo of spice is actually 1 kilo of gold at that time. So the Spanish king was very supportive, and Magellan traveled all the way, and he was supposed to go to the Spice Island, get the spices, and go peacefully to Spain, where he will be a hero at that time. So what mistakes he made? He was supposed to go, first mistake, he was supposed to go to Spice Island. He miscalculated where is he going, and by mistake, actually, he went to the Philippines. Small people, very little people, you know, they are just going around the sea. He didn't even think that these are like the Malaccan kingdom, which he has conquered 10 years ago. So, that's the place where story Cebu, and these are the two other heroes. Amabuco was actually the ruler of the land, while Lapu-Lapu was the king of the sea. No one could go around the sea and fight with him in the sea. He was a god savior. And he was really loving, caring for his people. Now, the checks they landed on Hamabon area. Hamabon accepted to follow Magellan on a condition he will be the king. He was not actually a king, but he wants to be a king of the whole area. But before he left back to Indonesia, what happened is Hamabon told him, okay, I'll follow you, but if you go there is a very troublesome man called Lapu-Lapu. He's in the near village. You should go and destroy him so I can control the area. And Magellan listened to him. And Magellan actually has 280 fighters, while Hamabon has thousands. Now Hamabon told him, I will go with you and help you. He said, I don't want your help. I can't manage that. I know how to manage these people. So he went to an area which he does not know what's going on there. He went to an unknown area. And he came from the north, which we call it now Magellan Bay. And to his luck, he doesn't know that there are rocks down. And the rocks stopped his chest. He got angry. He started shooting bamboo. It did not reach the shore. So he continued. He wants to reach it more. He spent his chest. He went down. The first thing he did, he burned the village. So the simple people got very angry and frustrated. When this man comes, he wants us to follow him, and he burns our villages. So they were actually in the house, and they jumped on them and they crossed the road. He was thinking that these people cannot go to the sea, but they were sailors, and they contacted them, and you can see here, this Lapu-Lapu actually killing Magellan. Now what happened is that he is actually, and these clever people who are fighters, real fighters by sword, realize that the Spanish people do not cover their knees, you see from the picture. And they hit them on their legs, and they fall down on their face as described. This story is given by actually a Spanish historian. There is nothing, I certainly, Filipino history, believe me, there is nothing about this, only 2 papers, and they are irrelevant to this. Now, the people ran away, and they went back, running, frightened. So what happened? There were 2 people. Now, if you remember, Eric was a slave of Magellan. He slaved him from Malacca because he does not know Malay language. He wants to use him to translate. He was with him for 10 years. And Magellan loved him. He's a very obedient servant person, very like Lebanese people. They really respect their senior. It's really in them. And he wrote in his will, if I die, this slave Eric should be released, should be free. Now the fellows did not accept Magellan well. And what happened? They wanted to give him a slave. So Eric, very quiet, went on. Look, it didn't happen. It was not. It was these people are going to kill you. And what happened one day? He made a make party, he poisoned the food, and he killed almost all the sailors except about 30 people. Now these were in the ships. The others died. Eric was freed and he got with him, no one knows that. And then they divided into 2 groups. A group ran back to South America where they were captured by the Portuguese. And another group went to the destination of Magellan, which is the Spice Island. They were only 18. They took the spices. They went all the way back to Spain, actually, and they arrived 1522. Now, the first person who went around the world was Imirex from Malacca. He was this poor man who really, and if you notice, let us go and analyze this from a military point of view, from a scientific point of view without emotions. Magellan actually made 7 fatal mistakes to be killed, and that's why the Portuguese king actually maybe thrown him out. What mistakes did he make? The first mistake, he miscalculated. That's actually right. Miscalculated where to go. He had never lack of knowledge, actually, of the that the tribal culture there was not actually a kingdom. It was a tribal culture. Actually, it was not a kingdom. And he lacked the knowledge of the area where to fight. Soldiers should know where to fight and how to fight. If they need to fight, when to pull out. Now you spoke about damage controlling surgery yesterday. Surgeons can operate and operate till the patient dies, and they should stop. Affected domain. He ignored the culture, the people who want to push them. He burned their village. He was so arrogant in his behavior that he really wants to do that. He refused help. If you are a surgeon and you are stuck in a problem, you should call your senior or another colleague. I would never mind calling another colleague anytime that you feel that I will deserve. He got angry, frustrated. Once he could not reach his aim, he was not patient. He could have come back, thought of it, redone it again. And finally, he did not know when to stop. He did not know when to stop. And again, he was distracted. Why? Why he was convinced to go and fight people, and his main objective was to go around the world. He missed a major aim to a minimum aim. Your objective is really to save the life of the damage control surgery. You don't go and remove an appendix. This happens. I've seen it many times. So you should be focused. Now, if you look to these mistakes, or the opposite, if you look to Eric and analyze it, he did exactly the opposite. That's why he was saved. That's why he was the best one to go around the world, although he was not so technically strong as Magellan, although he was following Magellan. Now all what you do is simple. Please, just replace that by that. It's exactly the same mistakes we do as servants. Now, very easy, you understand now why we should not make mistakes. And this goes to another story. I was actually in Bangkok in the surgical meeting last year. I was honored to be a student with Professor Sai in a medical writing workshop. You always should be a student. And usually I give my opinion. So Professor Sai told me, he's the editor of Journal of Surgery, I really will put you as a reviewer in my journal. Would you accept that? I don't mind, of course. 1 year later, last summer, he sent me a paper which is very sensitive politically. That was a paper written by the Americans, the Medical Sans Frontier, about the Kunduz rocket. And scientists should be non-political. I really advise that the tone of the paper should be reduced and look only the facts. No emotions. We shouldn't be biased. We shouldn't be biased actually politically. We should really be good scientists. So you work hard. This is my handwriting on the paper. You give the comments. It was a major revision. The paper is published. Great job, great paper. Believe me, once I started reading the few lines, I couldn't stop till I ended it. I sent the review the same day. One of the best papers in military surgery. I love that you read it, please, and I will make it simple for you. Now I thought, well, that's a great job. We have some comments, hopefully, from someone who was very near to it, Dr. Khalid. Then I got more. I will analyze now this for you, but actually, this paper, once you analyze it, this is a 92 bed hospital which was giving care for the whole north of Afghanistan. It was free of charge. Needed people, more than 1 million, 1.5 million were actually needing that hospital, and it was called the trauma center. It was not the hospital. It was a trauma center. I really, once they told me trauma center, I couldn't understand that. And in October 3rd, 2015, there was a friendly rocket, American rocket, that hit the hospital. If you look here, I've not been there. This data is all from the internet, by the way. You can get a lot of information from the internet. This is the hospital. Now, if you look, the paper aims just to look to the economical effect of this one rocket. One rocket, and look to the economic effect. War can destroy a lot of things. In the afternoon, I'll speak about the long-term effects. Really, it has dramatic effects. This is the hospital. Look to if you see that, that's a trauma center, you see here. But I think I don't have a marker, but if you can see clearly, you can see the hospital is the white one, transversely. Concentrate on that, concentrate on that, concentrate on that. That's after the rocket. That's after the rocket, okay? It's a dramatic injury. That's the hospital. These are the people in the hall. These are the people there, 14 staff written in the paper, dead maybe more, one of them a doctor who was honorable and author of the paper. One of the authors of the paper, I don't want to mention his name, died during that injury. I read it with passion, the paper, because I've been in that scenario as I will show you before. Now, if you look there, about 65% of them were actually, this hospital treated 99.5% trauma, only trauma, nothing else. They did not accept other things. And 65% of them were non-violent trauma, car accidents, falls, quarrels, suicides. It has nothing to do with the war. They treated only 30%, 35% that is related to the war. They treated mainly, majority, as we know from trauma, is orthopedic trauma and wounds. You need an orthopedic surgeon, majority actually wounds and orthopedic fractures. But if you look to this, look to these numbers. Believe me, I was shocked to see that. They operated about 1,700 trauma patients every year. That's trauma, one center, even more. 50% of them were limb or limb injury. These are actually, will have very high ICS, more than 9, definitely. So that's actually like a trauma center in USA that operating. With a mortality of 2.9%. It's exactly like a trauma center in USA. With the doctors working there. Now, if you look here, 30% work here, less than 15 years. They are kids. Actually, I wrote to the authors, you should put 18, because in WHO the definition is 18, but I accepted 19. 30% are kids of those who were actually treated in this hospital. 30%. Kids don't actually, is less than 30% in many of the communities if you go in the epidemiology. Now, what I was shocked, that they were collecting data from a surgical logbook, and they formulated the formula, calculating how many years you lose if this hospital was destroyed, each patient was served 23 years. That means if he's 50, he could have lived to 40, just to get a imagination for yourself. So if it was not there, kids would have died, people who are young would have gone, families would not have been brought up. This is what we should really think of. Now, what's amazing in this paper, please read it. It's a pure trauma center, very clear. The data collection in World is really amazing for me. The analysis is great. Economical study, beautiful study. I mean, I know trauma. Economical studies are really difficult. How can you do them in big hospitals? We don't know. How do you do them in the war? I couldn't realize that. And it's the only study in the literature of a friendly fire on civilians. All literature is on friendly fire on soldiers, because these are done by the military and they don't publish their errors on civilians. You got that point? Please read that here. Now, so I agree, the concluding paper, those who are working in the war should be protected. They have nothing, as we listened from Dr. Khalid. These are people who are helping other civilians. You cannot help them just to punish a population. You cannot do that. Now, I was happy. My God, it's a great paper. People will benefit from it. And then I got a message, actually, from Professor Saar. Would you like to write a comment on this topic? Oh my God, and this is really, I never heard about it in my military experience. I've never heard about friendly fire in meetings. Believe me, I've been attending a lot since 1990. Been attending a lot of conferences like this. I've never heard about it. But it's a challenge, you know. You have to take the challenge. And I said, okay, with pleasure, I will do that. So you go and do, this is actually for young people. I don't know. What shall I do? You go into an evidence medicine approach. That's the way you go. And what I did, you have to define your terms, exactly what terms you want. I took 3 terms: friendly fire, if you want this here, in the warfare field, etc. Collateral damage, I use collateral damage, okay? And I use the word fratricide. That's the term used by the military, by the way. They don't say friendly fire, they say fratricide. And I will tell you why. So you do such, you combine them. If you do a midline very well, you should be able to combine them and you get, that's what you do in a systematic review. I hate 89 titles. You follow the titles, you define the abstracts, you read the abstracts, you define the possible papers, you extract the papers, you get the original papers, and finally you decide which papers you want really to include in the study or evaluation for me. It's like a systematic review, but it's many. I could only locate 14 papers related to friendly fire and collateral injury in the whole midline study. So what did I find? Friendly fire is not specific, by the way, because if you define it as a bullet from your own weapon, you can't shoot your leg to be out. You got my point? Many soldiers shoot their leg so they can be out from military. You cannot be sure. He shot himself. But the definition by the Americans say it's a fratricide. That means it's an employment of a friendly fire. That is in an intention to injure your enemy, and by mistake you hit your friend. And that's the definition you use. Now, historically, this is an image from World War II. World War II, there was a 25-year second. He was supposed to go to his military in USA, and then he has to say a password. And he said it by mistake, so they shot him in his belly. And how do you know it's there? Because it's their bullet. I'm sorry. That's actually their bullet. It's a 45mm pistol. So no, this is American bullet. So it should be from our own, so it's a friendly fire. You got that point? Now, if I go to the literature, Lieutenant Confederal James Longstreet is a very famous leader in the American Civil War. He was by a friendly fire. And this is the surgeon actually who treated him. He had a bullet that came from his back shoulder and went anteriorly near the trachea. So he came with a frothy bleeding from the mouth. He's already suffocated. The surgeon treated him. So it went through the back. Now, if you go to the anatomy of that, it hit the brachial plexus and it hit the right recurrent laryngeal nerve. So he used to go like that. He had the hoarse voice and he couldn't raise his right arm. That is historical, really written in the literature. Now I will tell you my personal experience of friendly fire. And I have to call my friends, old friends. I have to call my old friends on this. This was in Adan Hospital. There was a rocket that burned the whole doctors, hostel, and nurses. Four of my colleagues, I personally saw them. This is one surgeon who's really operating. I contacted him before he had been there. There's a shrapnel in his right lung. He survived the left hemothorax. Two of my colleagues, I saw one, he still continues operating. He lost his eye, left eye. Another colleague, actually, he lost half of his hand, and he changed surgery to dermatology. But the most dramatic one I've seen, and I was really part fixing it, is a very sincere consultant whom I like too much. His wife, he saw the head of his wife chopped in front of him. He's a very senior, very nice surgeon. So we have to bury her during the war. Our hospital was 20 kilometers. We have to travel without petrol, very little petrol, minimum, under bombardment for 20 kilometers. And in a very breezy, sunny noon, we buried his wife. We were only 3. And believe me, I never realized the dramatic effect of a friendly fire on a person. He's a long, tall man. He was shaking, was almost going to fall down. That effect, it's well known that in the literature, if you witness such a thing, you cannot forget it. It's a post-traumatic effect. I still remember it, so what about him seeing it? He continued, he's a strong man, but I'm sure it will have things in his memory. Now, there are what military people try to reduce it by simulation. But I can tell you the incidence, it did not decrease. It's about 20%. Actually, there is a trial by the police in USA. They made like a simulation, people trying to save hostages, and the policemen killed 20% of the hostages by mistake. Exactly like the war. Majority, 30% of them, this is from the Gulf War, 30% are by air to ground hitting. Now, what are the causes? They're the same. Lack of coordination, lack of communication, misidentification, stress, inexperience. I can tell you from experience, these are common mistakes in medicine and surgery specifically. The paper is there. My comments actually been published. Exactly this lecture is the 2 pages of my comments on the paper. You can read it with all the references, 9 references I used actually. Now I can tell you a take-home message. Friendly fire is a human error. Friendly fire is similar to medical errors, may have dramatic effects, and we have to learn from it. Trauma surgeons should learn from the military in different areas. We don't need really to make the same mistakes. They are good at strategy. Now I leave you with my favorite 7 points. In trauma, always you plan, you prepare, you protect yourself, you practice military surgery, you pass your knowledge to the others, as I said, you publish, and most important, you pray that you are not killed in you. Thank you very much, Prof.
Thank you very much for interesting information. Now, as a token of appreciation, Council invited both our chairman, Dr. Kwanan Haidari Wong, and accompanied by Dr. Sabaya Faiza Jamaluddin, to deliver the souvenir to the speaker.